Are you, or perhaps a loved one, over 70? Did your doctor, maybe with a reassuring pat on the shoulder, tell you that 140 over 90 blood pressure is just your age-related normal? If so, please forget those words immediately. Wipe them from your mind. Because today, we are going to debunk the most dangerous, the most insidious, and tragically, the most common myth in modern cardiology. This is a myth that is costing lives every single day, shattering futures, and turning active older people into the frail and dependent. Stay with us until the end. You will find out why those blood pressure readings you might currently consider safe are actually a ticking time bomb nestled right in the core of your health. And, most importantly, we will tell you exactly what you need to do about it. Where on earth did this idea come from? This notion that blood pressure must rise as we age and that 140 over 90 is practically a gift for someone in their 70s. The roots of this dangerous misconception trace back decades, deep into the medical practices of the mid-20th century. Back then, doctors simply didn't have the sophisticated arsenal of effective and safe blood pressure medications we have today. The available drugs often came with severe side effects, which the elderly found particularly hard to cope with. Furthermore, our understanding of vascular aging was completely different. There was a prevailing theory that as we age, arteries inevitably stiffen or calcify, and the heart supposedly needed to generate higher pressure just to push blood through these non-elastic tubes and reach vital organs. It became a vicious cycle. Lowering the pressure was risky because of the drug side effects, yet leaving it high seemed logical based on that outdated physiology. That is how the concept of acceptable or normal, age-related high blood pressure was born. Doctors truly believed they were choosing the lesser of two evils, but medicine progresses. What was justifiable caution 50 years ago is now, sadly, a form of deadly ignorance. Let's start with the most crucial statement of all. A blood pressure reading of 140 over 90 millimeters of mercury, or 140/90, is not normal. This is true whether you're 70, 80, or even 90 years old. According to all modern international clinical guidelines, European, American, or otherwise, this reading is classified as stage 1 arterial hypertension, or simply put, high blood pressure. This is a diagnosis. It is a condition that requires attention, monitoring, and in the vast majority of cases, proper medical treatment. Just imagine you have a temperature of 37.5 degrees Celsius. It's certainly not 39. And yes, you can still go to work or get things done around the house. But would you call it normal? No. You know a low-grade inflammatory process is happening. Something is clearly not right in your body. High pressure is exactly the same. 140/90 isn't a critical hypertensive crisis that will make you collapse immediately. Instead, it's that slow-burning process that gradually, but surely, starts destroying your blood vessels from the inside out. Day after day, month after month, year after year, the real danger of this condition lies precisely in how harmless it seems. You may not feel this high pressure at all. You might not have headaches, dizziness, or floaters in front of your eyes. You're simply living your life, convinced that everything is fine because everyone has pressure like that at my age. And this is the main trap. While you operate under this dangerous misconception, the disease is quietly doing its destructive work. It's like termites silently eating away at the supporting beams of your house. Externally, everything looks solid and reliable, until one terrible day, the roof comes crashing down. In our case, that collapsed roof takes the form of a stroke, a heart attack, or heart and kidney failure. That's why the first thing you must do is change your attitude. Stop referring to this disease as normal. You need to acknowledge that 140/90 is a serious issue that needs to be addressed, not just an unavoidable consequence of getting older that you simply have to put up with. This is the first and most vital step towards protecting your health and ensuring you continue to lead an active, fulfilling life. To truly grasp why even what seems like a minor elevation in blood pressure is so incredibly destructive, let's take a moment to picture our arteries. Ideally, an artery isn't just a simple pipe, it's a vital, complex, living organ. The innermost wall, what we call the endothelium, is an incredibly delicate layer of cells, absolutely smooth, like fine silk. This lining performs crucial work. It regulates the artery's flexibility, stops blood clots from forming, and controls the necessary exchange of substances between the blood and the tissues. Now picture that delicate system constantly dealing with blood flow under excessive pressure. What does a systolic reading of 140 over something really mean? It's comparable to trying to water delicate flower beds with a high-powered pressure washer. This relentless, excessive force simply hammers the delicate lining. It causes tiny, microscopic cracks and injuries. Naturally, the body immediately tries to mend these breaches. How? It dispatches an emergency repair crew, platelets and the well-known bad cholesterol. Those low-density lipoproteins. They effectively plaster over these cracks, forming what we call an atherosclerotic plaque. Initially, this temporary patch saves the vessel from immediate rupture. But here is the critical problem. The blood pressure stays elevated. It continues to assault the walls, causing constant new micro-traumas. That repair crew works relentlessly, and the plaque grows and builds up, stacking layer upon layer, much like a stalagmite forming in a cave. Eventually, the plaque gets bigger and bigger, narrowing the vessel's channel. Blood cannot flow freely anymore. Furthermore, the artery wall itself, where this constant inflammatory construction is taking place, loses its essential springiness. It becomes rigid, stiff, and fragile. Instead of a strong, flexible hose, you now have an old, cracked plastic tube, ready to snap at any moment. And this devastating process is happening simultaneously in thousands of vessels across your entire body, in your heart, your brain, your kidneys, and your eyes. This is the reality for anyone living with what some people mistakenly call normal for my age pressure, a reading of 140 over 90. It is a slow, relentless self-destruction of the entire vascular system. Right then, let's turn our attention to the heart. It really is the engine room of our entire circulatory system, and sadly, it's the primary casualty when high blood pressure sets in. So, what exactly does the heart have to do when it's forced to pump blood through narrow and stiffened arteries? It has to work under colossal strain. Think of it like trying to squeeze thick toothpaste out of a tube that has a tiny, almost blocked hole. You'd have to press with all your might, wouldn't you? That's precisely what your heart has to do. To overcome that fierce resistance in your vessels, the heart muscle, the myocardium, is forced to contract much, much harder than it normally should. Now, the heart is a muscle, just like the ones in your arms. And what happens if you constantly put a muscle under excessive stress, say by lifting weights that are far too heavy every single day? That muscle is going to grow and increase in size. We call this process hypertrophy. You might think, well, that sounds good. My heart is getting stronger. But that is a very dangerous misconception. The thickening of the left ventricle, that's the main pumping chamber, and the part that suffers first, is actually a dangerous pathological process. The muscle is getting bigger, but the blood supply simply cannot keep up with that growth. The coronary arteries, which feed the heart itself, can't provide enough blood and vital oxygen to this overgrown mass of tissue. Consequently, the heart cells start starving for oxygen. We call that ischemia. Worse still, the thickened muscle becomes rigid. It loses its vital ability to relax fully. This ruins the heart's ability to refill properly with blood, eventually leading to a very severe condition, chronic heart failure. People start suffering from shortness of breath, swollen ankles, and crushing fatigue. Their heart is simply worn out. It breaks down like a faithful old engine running on empty. It's been working flat out for years, trying to cope with the pressure that someone, unwisely, once labelled normal. And at some point, its reserve capacity just runs out. This exhaustion can manifest as a myocardial infarction, a heart attack, where part of the muscle simply dies due to lack of blood supply, or even a sudden cardiac death. That, ladies and gentlemen, is the devastating price we pay for believing the myth of age-related blood pressure. The next vital organ that bears the brunt of high blood pressure is our brain. The brain is incredibly demanding when it comes to energy. Although it only accounts for about 2% of your body weight, it demands up to 20% of all the oxygen and nutrients entering your system. To achieve this, it relies on a perfectly functioning blood supply network made up of the finest, most delicate blood vessels. So, what happens to these fragile vessels when they are subjected to constant pressure of 140/90? Exactly the same destructive process we have already described begins to take hold. The walls of the arteries feeding the brain thicken, they lose their elasticity, and their passages narrow due to the buildup of atherosclerotic plaque. This leads to chronic cerebral circulatory impairment. Essentially, the brain is constantly starved of oxygen and glucose. How does this manifest? Initially, the symptoms can be vague: poor memory, reduced concentration, quick fatigue during mental tasks, ringing in the ears, and dizziness. Sadly, many people dismiss these signs, blaming old age, general tiredness, or anything but their blood pressure, which they mistakenly believe is perfectly normal. The person gradually begins to struggle with thinking clearly. They find it hard to find the right words, and they start forgetting recent events. This progressive condition is called vascular dementia, or more simply, senile dementia, and hypertension is one of its primary causes. But that's still not the worst of it. The most severe threat posed to the brain by hypertension is a stroke. There are two main types of stroke. The first is an ischemic stroke. This happens when an atherosclerotic plaque inside a brain vessel ruptures, forming a blood clot, a thrombosis, that completely blocks the blood flow. That section of the brain, deprived of its vital supply, simply dies. The second type is a hemorrhagic stroke. This occurs when a brittle vessel wall, damaged and weakened by high blood pressure, cannot cope with a sudden spike in pressure and simply bursts. This leads to bleeding in the brain, which compresses and destroys the surrounding brain tissue. Both outcomes are a catastrophe, capable of instantly turning a person into a severely disabled individual confined to their bed, or tragically ending their life altogether. And the risk of this catastrophe escalating multiplies dramatically when you are living with blood pressure of 140/90 and believing that it is acceptable. High blood pressure deals an equally serious blow to the kidneys. Your kidneys are the body's unique filtration system. Every single minute they process huge amounts of blood, constantly cleaning out toxins and waste products. All this sophisticated work happens inside millions of microscopic filtering units called glomeruli. These are essentially delicate knots of tiny capillaries. Now imagine blood constantly entering these thin-walled capillaries under permanent high pressure. This excessive force literally pounds and destroys the fragile structure of those kidney filters. The capillary walls thicken and harden, a process known as scarring or sclerosis. The medical term for this scarring is nephrosclerosis. Gradually, one by one, these vital filtering units fail and stop working. Your kidneys become less and less effective at cleaning your blood. Toxins that should have been eliminated through urine start building up in the body. This condition is called chronic kidney disease, or CKD. The problem is that, just like with the heart and brain, this damage develops very slowly and silently. In the early stages, you may not feel anything at all. The first obvious symptoms, things like general weakness, fatigue, swelling, or changes in urine colour, only appear when a significant portion of the kidney tissue is already permanently destroyed. At this late stage, the only life-saving measures are often either hemodialysis, a procedure for artificially cleaning the blood that ties a person down for the rest of their life, or a kidney transplant. This is a truly tragic outcome, and the most frustrating part is that in a huge number of cases, it is caused by high blood pressure that was either untreated or poorly managed. People walk around for years with readings of 140 or 150, dismissing it as just their age, never realizing that they are slowly killing their own kidneys. By the time the damage becomes obvious, it is often too late to make any drastic changes. That is why managing your blood pressure isn't just about protecting your heart and brain. It is the critical factor in keeping your kidneys healthy well into old age. Now let's turn our attention to the hard data and the reality of evidence-based medicine. The entire myth about an acceptable blood pressure norm for your age has been completely shattered by numerous large-scale scientific trials. One of the most significant was the SPRINT trial, the results of which were published back in 2015. This study involved over 9,000 people, aged 50 and older, who were already at high risk of cardiovascular disease. Participants were divided into two main groups. In the first group, doctors aimed to reduce the systolic or top blood pressure number down to 140 millimeters of mercury. This was standard practice at the time. The second group had a far more ambitious goal, achieving a blood pressure level below 120. This was the intensive treatment arm. The study was meant to run for about 5 years, but it had to be stopped early, after only 3. Why? Because the results were so overwhelmingly conclusive and unambiguous that it became simply unethical to continue observing the standard group. It turned out that in the intensive control group, where BP was maintained at the 120 level, the number of heart attacks, strokes, cases of heart failure, and deaths from cardiovascular causes was 25% lower than in the standard control group. Furthermore, overall mortality from all causes dropped by 27%. Just think about those figures. A quarter of tragic health events were prevented purely by tighter blood pressure management. This study truly shook the medical world and led directly to the overhaul of almost all existing clinical guidelines. SPRINT demonstrated one thing unequivocally. Within reason, the lower the blood pressure, the better. That 140 target is an outdated and potentially dangerous approach. Crucially, this applies equally to older people. The SPRINT trial included a large number of participants over the age of 75, and the benefits of intensive blood pressure lowering in that specific age cohort were just as compelling. Right, so what are the modern targets for blood pressure? What figures should someone in their 70s or even older really be aiming for? Well, according to the latest 2018 guidelines from the European Society of Cardiology, and these are shared by specialists worldwide, the approach needs to be quite specific. If you are aged between 65 and 80, and you're already being treated for high blood pressure, your systolic or top reading should fall between 130 and 139 millimeters of mercury. Crucially, this is only if you're tolerating the treatment well. That means 139 is the absolute ceiling, the top of the acceptable limit. It is not the normal target. The ideal goal we should all be striving for is actually below 130. As for your diastolic, the bottom number, that needs to be kept below 80. So, the target pressure for the majority of older people is 130 over 80 or lower. Now compare that with the old, almost mythical standard of 140 over 90. The difference is absolutely huge. This isn't just a matter of 10 or 20 points on the monitor screen. This gap represents lives saved, strokes and heart attacks prevented, and years of active, good quality life maintained. It's vital to understand that these targets haven't been plucked out of thin air. They are based on analysing data from hundreds of thousands of patients globally. This is the result of decades of very careful scientific work. Ignoring this evidence today would be like trying to treat a nasty infection with charms and spells when we actually have antibiotics available. Medicine moves on, and it is our job to make the most of its progress. The main breakthrough in modern cardiology regarding hypertension treatment is the clear understanding that there is no such thing as a safe high reading. Any deviation from that perfect 120 over 80 carries a risk. The joint task of the doctor and the patient is to minimize these risks by keeping your blood pressure as low as possible while still ensuring the level is comfortable and safe for you personally. Now, many of you might be asking a very sensible question. Isn't it dangerous to lower blood pressure this aggressively in older people? This ties into another common misunderstanding, the myth that if an older person's pressure drops too low, their brain won't get enough blood, they'll faint, they'll fall over, and eventually develop dementia. This fear is very real, not just for patients, but sadly sometimes for a few of the more traditional or old-school doctors. We call this fear of orthostatic hypertension. That's simply the sudden drop in pressure when you stand up quickly from lying or sitting down. Yes, it's true. This side effect is possible with blood pressure medication, especially when you first start treatment or if the dose isn't quite right. However, modern research, including that landmark SPRINT study we mentioned, clearly shows that if the treatment is managed properly, these risks are tiny and completely outweighed by the massive benefits of lowering the pressure. In the aggressive treatment group in the SPRINT trial, they did see slightly more instances of lightheadedness and falling. But here's the crucial bit. The number of serious injuries resulting from those falls was exactly the same in both groups. Yet, the number of strokes and heart attacks, as we recall, was reduced by a massive 25%. What would you rather risk? A hypothetical, unlikely stumble that might result in a bruise, or a very real, high risk of suffering a stroke that could leave you paralysed? The answer, I think, is plain common sense. The key phrase here is a professional, managed approach. Treating high blood pressure in the elderly is truly an art form. Your doctor must tailor the treatment very carefully, starting with small doses, gradually increasing them, and constantly monitoring your progress. It's vital to use modern medications that work gently and smoothly over a long period, avoiding sudden spikes or drops in pressure. Patients also need to be taught simple safety rules. Get out of bed slowly. Avoid sudden movements. If we follow this careful strategy, achieving a target pressure below 130/80 is perfectly safe, and frankly, absolutely essential for the vast majority of older people. But why, despite all this compelling scientific evidence, does the myth of normal for your age blood pressure persist? Why do we still hear doctors, perhaps down at the local surgery, say things like, "Mary dear, what do you expect? You're 80 years old. 150/90 is just your working pressure"? Well, there are a few reasons for this. The first, as we've already touched upon, is sheer inertia. Old habits die hard. Doctors who trained 30 or 40 years ago absorbed those older dogmas, and changing their ways can be difficult. They're used to doing things the way they always have, and they probably feel that sticking to the old methods is safer. The second reason is the terrible lack of time. In a standard NHS appointment, a GP has maybe 15 or 20 minutes per patient. In that short window, they have to take history, conduct an examination, write prescriptions, and fill out endless piles of paperwork. They simply don't have the time to sit down and properly explain to an older person why their pressure needs to come down, how to take the medication correctly, and what symptoms to watch out for. It's much easier to trot out that stock phrase about normal for your age and send the patient happily on their way. This isn't malice. It's sadly just a broken system. The third reason lies with the older patients themselves. Many harbour a deep scepticism about modern medicine. They're wary of all those chemicals and often put too much faith in home remedies or old wives' tales. They frequently fail to stick to the doctor's instructions, perhaps stopping medication the moment they feel a little bit better. A doctor, seeing this reluctance, might simply throw their hands up and decide it's better for the patient to run at 140/90 than to take nothing at all. Finally, the fourth and crucial reason is the lack of clear, straightforward public health information. People are getting their health advice from dubious television shows, from the wild west of the internet, or from gossip over the garden fence. In all this noise, it's terribly easy to get lost and believe the myth that is most convenient and comforting. After all, it's far nicer to think that your blood pressure is perfectly normal for your age than to accept that you might have a serious chronic condition requiring lifelong management. These factors, working together, create the fertile ground where this dangerous misconception about age-appropriate blood pressure continues to thrive. Right, let's unpack another term often used to excuse persistently high blood pressure, the so-called working pressure. What exactly does that mean? Typically, people use this phrase to describe the pressure level where they subjectively feel perfectly fine and functional. For instance, someone might say, "My working pressure is 150/90. If it drops any lower, I feel weak and dizzy, but at 150, I feel perfectly spry and alert." Now, this is one of the most insidious, subtle traps of hypertension. The crucial point here is that the human body possesses a truly astonishing capacity for adaptation. If someone lives for years with sustained high pressure, their blood vessels, especially those in the brain, become accustomed to this constant, powerful rush of blood. The brain's natural self-regulation system actually recalibrates itself to accept this new, frankly, pathological level. Consequently, when we start using medication to bring that pressure down to genuinely normal readings, that regulatory system malfunctions. The brain mistakenly signals that too little blood is flowing in, setting off symptoms often associated with low blood pressure, weakness, lightheadedness, and profound drowsiness. The patient then draws the dangerous incorrect conclusion: normal pressure clearly isn't right for me. It makes me feel unwell. They stop the treatment, happily returning to their comfortable high readings. But what does that word comfortable truly mean? It provides subjective comfort for how you feel, certainly, but absolutely no comfort for your delicate blood vessels. While you may feel fine at 150, your arteries, heart, brain, and kidneys are actually continuing to sustain damage, often at an accelerated rate. Think of it this way: it's like being in a room where the concentration of carbon monoxide is slowly and imperceptibly increasing. Initially, you feel nothing. In fact, you might even feel pleasantly warm and sleepy, but ultimately, this adaptation leads to catastrophic failure. That is precisely why the term working pressure, if it sits above the accepted norm, simply does not exist in modern evidence-based medicine. There is only habitually high pressure, pressure that the body has dangerously adapted to. The job of a competent doctor is not to indulge this vicious adaptation, but rather to gently, slowly, and very carefully retrain the patient's body to function optimally at normal blood pressure levels. This process might take several weeks, or perhaps even a few months, but it is absolutely crucial and necessary to safeguard the patient's long-term health and ultimately to save their life. We need to pay special attention to the situation concerning the very elderly, those over 80 or 85, especially if they are frail, have multiple underlying health conditions, comorbidities, and what we refer to as the frailty syndrome. In these cases, the approach to lowering blood pressure must be even more cautious and highly individualized. Crucially, we don't have the same robust evidence base for this group as we do for younger patients, as large-scale clinical trials usually exclude these frail individuals. This means the doctor must weigh the potential benefits against the potential risks with extreme care. Aggressively dropping blood pressure in a frail person can be genuinely dangerous, potentially leading to falls, worsening kidney function, or even impaired cerebral blood flow. However, even this level of caution doesn't mean that a reading of 160 or 170 over 100 is normal for them. That pressure is still a significant risk factor. It simply means that our treatment goals might need to be less stringent. For instance, for a frail patient over 80, a systolic pressure target below 150 mmHg might be perfectly acceptable. The main guiding principle here is always, do no harm. Treatment should be initiated with minimal doses of a single medication, titrating the dose up very slowly and carefully while consistently monitoring the patient's well-being and pressure readings. It's crucial to assess more than just the numbers on the monitor. We must look at the person's overall condition, their cognitive function, their ability to manage daily tasks, self-care, and whether they experience dizziness. In contrast, if an 85-year-old is otherwise fit, active, and doesn't have major coexisting health problems, the same guidelines apply as they would for a 70-year-old. Their target pressure would still be in the region of 130 to 139. Chronological age, the number on their passport, is not the main criterion. Biological age and overall health status are far more important. In none of these scenarios, however, is a reading of 140 over 90 considered the desired target or normal. At best, for the very frailest patients, it might be the upper limit of acceptable control, but it is certainly not an indicator of good health. Let's have a little chat about something truly important: getting your blood pressure reading right. This is absolutely the cornerstone of diagnosing and managing hypertension, because honestly, if you measure it incorrectly, you'll end up with inaccurate numbers, and those numbers could lead both you and your doctor down the wrong path when deciding on the best treatment. There are a few simple, golden rules we need to follow. Rule number 1. Always measure your blood pressure in a calm setting, and only after you've sat quietly resting for 5 to 10 minutes. Never check it straight after any physical activity, high emotions, or if you've just had a cup of coffee or a cigarette. All those things can artificially inflate your readings. Secondly, sit comfortably, leaning back against the chair. Don't cross your legs. Make sure both feet are flat on the floor. Crucially, the arm you are using should rest on a table at the level of your heart. Third, the cuff needs to go on your upper arm, about 2 to 3 centimeters above the crook of your elbow. Make sure it's on your bare skin, never over clothing. The size of the cuff must match the circumference of your arm. If it's too tight, it will give you a reading that's too high. If it's too loose, it will read too low. Fourth, while the measurement is being taken, you must remain silent and still. No talking or moving. Fifth, take 2 or 3 measurements, waiting 1 to 2 minutes between each one, and then record the average value. And finally, rule number 6. Measure regularly. Ideally, this should be twice a day, once in the morning after you wake up, and again in the evening before you go to bed, and you must keep a pressure diary. The data from this diary, not just that single reading taken in the doctor's surgery, where many of us get white coat hypertension and our pressure shoots up, is the most valuable information for finding the right treatment. Modern automatic monitors are reliable and accurate instruments, provided you use them correctly. Don't hesitate to ask your GP or practice nurse to show you the proper technique, and have them check that your home device is accurate. This simple step can fundamentally change the approach to your healthcare and help prevent serious mistakes. How should you proceed if you or a loved one regularly record blood pressure readings of 140 over 90 or higher? First and foremost, don't panic, but please don't ignore these numbers either. Understand that this isn't just a sign of old age. It's often a symptom of an underlying condition that genuinely needs attention. Your second step is to book an appointment with a knowledgeable medical professional, usually your GP or a consultant cardiologist. Crucially, you need to find a specialist who is up to date with modern treatment guidelines. If a doctor dismisses your concerns or the readings in your blood pressure diary, perhaps suggesting it's normal for your age, then it might be time to look for a second opinion. You are entitled to high-quality medical care based on the latest scientific evidence. Before your doctor's visit, make sure you prepare. Always bring the log of your blood pressure readings, ideally covering at least the last 2 weeks. Make a clear list of all medications you take regularly, including any vitamins and supplements. Prepare your questions beforehand. Don't hesitate to ask why a specific drug is being prescribed, what its potential side effects are, and what target blood pressure level you should be aiming for. Your role is to be an active partner in your treatment, not just a passive recipient. Your doctor will likely recommend further tests to assess the condition of your target organs. This might include an electrocardiogram, ECG, an echocardiogram, an ultrasound of the heart, and general blood and urine tests. These checks are vital for building a complete picture of your health and ensuring the safest and most effective treatment plan is chosen. Remember, treating hypertension isn't a sprint, it's a marathon. It's a lifelong commitment requiring patience and discipline, but the ultimate reward in this marathon is the preservation of your long-term health and well-being. Modern treatment for high blood pressure isn't just about popping pills. Non-drug methods, essentially changing your lifestyle, play a huge, sometimes deciding role. And this is just as crucial in later life as it is when you're younger. The first thing we need to look at is diet. The primary enemy for anyone with high blood pressure is salt, or sodium chloride. The sodium in salt causes the body to retain fluid, which increases the volume of blood circulating and pushes your pressure up. The recommended daily intake for someone with hypertension is no more than 5 grams a day. That's roughly 1 level teaspoon. Crucially, this limit includes not just the salt you add at the table, but the hidden salt found in ready-made products like bread, cheese, sausages, tinned foods, and sauces. That's why it's so important to read food labels carefully and try to prepare meals yourself, perhaps using herbs and spices instead of salt. Secondly, we must address weight management. Every extra kilogram puts added strain on your heart and blood vessels. Losing just 5 to 10% of your current body weight can lead to a very significant reduction in your blood pressure reading. Thirdly, appropriate physical activity. We aren't talking about breaking records at the gym. For older individuals, regular, moderate aerobic exercise is ideal. Brisk walking, Nordic walking, swimming, or therapeutic exercises. Just 30 to 40 minutes a day, 5 times a week, is enough. This trains your heart, improves the flexibility of your blood vessels, and helps you keep your weight in check. Fourthly, stopping smoking entirely and limiting your alcohol intake. Nicotine constricts the blood vessels and causes a sharp rise in blood pressure, and large amounts of alcohol also contribute significantly to the development of hypertension. All these steps genuinely work. Sometimes, in the very early stages of the illness, lifestyle changes alone are enough to normalize your blood pressure without medication. But even if you have already been prescribed drug therapy, these rules remain absolutely essential. They boost the effectiveness of your medicines and may allow you to reduce the required dosage. Right, let's talk about medication. A lot of older people panic about taking too much chemistry, or worry about getting addicted to pills. Honestly, that's a dangerous and harmful myth we need to put to rest. Today's blood pressure treatments are the result of decades of research. They are effective, and when prescribed correctly, they are absolutely safe. Far from harming your liver or kidneys, these modern medications actually protect them from the destructive strain caused by high blood pressure. You must take this medicine for life. High blood pressure is a chronic condition. You can't cure it with one short course of pills, like a common cold. The medication doesn't fix the underlying cause. It simply controls the main symptom, high pressure. The moment you stop taking your tablets, your blood pressure will immediately shoot back up, and the whole destructive process starts again. Think of it like glasses for someone with poor eyesight. You wouldn't expect your vision to magically fix itself just because you wore spectacles for a month, would you? You wear them constantly so you can see properly. It's exactly the same with blood pressure medication. You take them every day to keep your pressure stable and protect your vital organs. It is vital that you take your medication exactly as your doctor prescribes, at the same time every day, without fail. Never adjust the dose or stop taking them on your own, even if you feel brilliant and your monitor shows normal readings. In fact, normal readings aren't a reason to stop. They are proof that the treatment is actually working. There are currently 5 major classes of medication available for high blood pressure, and your GP can combine these to find an effective regime for almost any patient. If you experience side effects from any pill, please don't just tolerate them or stop taking them suddenly. Tell your doctor immediately, and they will find you an alternative. Modern medicine offers huge possibilities. You absolutely can and should find your perfect treatment plan. Let's revisit the numbers, shall we? What exactly do we mean by 140 and what do we mean by 90? Systolic pressure, or the top number, the 140, is the force with which your heart pushes blood out into the arteries when it contracts. Diastolic pressure, or the bottom number, the 90, is the pressure that remains in your vessels when the heart is relaxed between beats. For a long time, doctors believed that for older patients, high systolic pressure was the main danger, and that we could afford to pay less attention to the diastolic number. However, the latest evidence clearly shows that both readings carry independent prognostic value. If either number is higher than the recommended limits, it significantly increases your risk of serious cardiovascular events. A particularly concerning condition is what we call isolated systolic hypertension, or ISH. This is when the top number is very high, say 160, but the bottom number is perfectly normal, perhaps 80. This pattern is very typical in older adults and is directly linked to the increased stiffness of major arteries, particularly the aorta. In the past, this was often dismissed as just an inevitable sign of aging, but today we know that ISH is a potent risk factor for strokes and heart attacks, and it absolutely requires the same proactive treatment as conventional high blood pressure. So, when you look at your blood pressure monitor, both figures matter. If even one of those numbers exceeds the accepted targets, generally 130/80, it is a cause for concern and needs discussing with your GP. Don't reassure yourself by thinking, well, at least the bottom number is fine. That thinking simply doesn't hold up. This ticking time bomb doesn't stop just because one hand on the clock is broken. Your vascular system works as one unit, and strain is being put on it from both sides, both when the heart contracts and when it relaxes. Underestimating the danger of either reading is a critical error that could cost you dearly. Let's take a moment to look at the psychology of it all. Why is that myth, the one about high blood pressure just being a normal part of getting older, so comforting, so tempting? It's because it gives us a convenient excuse to step back and shed our responsibility. It creates a cozy illusion that we are somehow in control of a situation where, frankly, we are not. Facing the truth that you have a chronic, potentially life-limiting condition that demands lifelong monitoring and a genuine change in habits is incredibly difficult. It asks for real courage, discipline, and sustained effort. It's much, much simpler just to believe that it's all down to the natural process of getting old, something you simply can't influence. Phrases like "what will be," or "you can't cheat fate, I'll live as long as I'm meant to," are incredibly common, particularly amongst our generation. They act as a neat psychological shield against an uncomfortable truth, but that shield comes at a very high price. It completely paralyzes the will to take action. We stop checking our blood pressure because why bother getting ourselves worked up over the numbers? We skip our medication because it won't make a difference anyway. We carry on with the diet we're used to and keep living that sedentary lifestyle, telling ourselves, "I'm too old to change now." This is a dead end. It's the direct road to a stroke, a heart attack, and an old age where you lose your independence. That's why tackling hypertension is primarily about tackling our own fears, our fixed ideas, and sometimes, yes, our sheer laziness. It requires a fundamental shift in perspective. It means accepting full responsibility for your own well-being. You need to become the chief executive officer of your own health. The doctor is your trusted consultant, your indispensable helper, but the heavy lifting has to be done by you. Daily monitoring, sticking religiously to your medication, eating sensible meals and keeping active, it's all completely within your control. And when you look at your diary and see those stable readings, say 125/75, you won't feel weak. You'll feel a profound sense of pride and confidence about the future. You will truly understand that you are managing the condition, not the other way around. Let's look at two possible futures for someone reaching 70, especially if their blood pressure is sitting around 140/90. Scenario 1. The "it's just my age" myth. This person truly believes in this dangerous misconception. They rarely check their pressure, they don't take their medication consistently, and they decide that slight dizziness or ringing in the ears is simply part of getting old. They carry on living exactly as they always have. What awaits them? For a year, 2, perhaps even 5, their blood vessels will slowly degrade. Initially, they'll notice they tire more quickly. They might get breathless just climbing the first couple of flights of stairs. Then their memory starts to fade, and concentrating becomes a struggle, until one fateful day, perhaps following a stressful event or strenuous activity, their blood pressure spikes, potentially hitting 200. An ambulance, a hospital stay, and a diagnosis of a hypertensive crisis. They get stabilised, the acute situation is dealt with, and they are sent home. But the core problem remains unsolved. Sometime later, maybe in the middle of the night or early morning, disaster strikes, an ischemic stroke, paralysis down one side of the body, and loss of speech. Life from then on becomes a struggle for every basic function, utterly dependent on loved ones. Their active life is over. Scenario 2. The proactive approach. This person recognises that 140/90 is a medical issue, not just a nuisance. They visit their doctor, undergo the necessary tests, and start a personalised treatment plan. They invest in a reliable blood pressure monitor and keep a regular logbook. Crucially, they adjust their diet and make an effort to move more. Every day, they take 1 or 2 small tablets. As a result, their blood pressure remains stable, sitting comfortably around 130/80. What awaits them? They continue to lead a rich and active life. They enjoy walks with their grandchildren, tend to their garden or allotment, meet friends, and read books. Their brain receives enough oxygen and blood flow, maintaining a sharp mind and good memory. Their heart works efficiently without being overloaded, and their kidneys function properly. Yes, they have a chronic condition, but it is fully managed and under control. They can look forward to another 10, 15, or even 20 years of meaningful, high-quality life. The only difference between these two scenarios is knowledge, combined with one simple daily action. Surely that is worth abandoning a dangerous myth. It's vital to talk about the role of family members here. If you have elderly parents or grandparents, your involvement in helping them manage their blood pressure can be absolutely crucial. Sadly, older people can often be a little set in their ways. They might be distrustful of doctors or simply forget to take their medication. Your job isn't to scold them or lecture them, but to become their partner and their ally. Help them understand the core issue. Perhaps watch this video together. Explain in simple, straightforward terms why monitoring their blood pressure is so important. Buy them an easy-to-use automatic blood pressure monitor and show them how to use it. Help them keep a proper blood pressure diary. You could even turn this into a daily ritual or a little game. Make sure they are taking the medication prescribed by their doctor exactly when they should. Those special weekly pill boxes with compartments for each day are incredibly useful for this. Support their lifestyle changes, cook less salty meals for them, and invite them out for walks together. Offer to go with them to their GP appointments, and help ask the doctor any questions they might be worried about. Your support and active involvement are the most powerful factors helping your loved ones follow their recommendations and ultimately live longer. Often, an older person feels quite isolated in their struggle with an illness. Seeing that you care and that you are there for them gives them strength and motivation. Don't dismiss their health complaints, and most importantly, do not support the myth of the normal for your age blood pressure. If you hear your mum or nan say that the doctor said 140 is fine, don't agree with them. Gently but firmly explain that medicine moves fast, and today the standards are different. Your timely and well-informed advice might just save the life of the person you cherish most. Let's move on to the money side of things. We hear far too often that some people, especially pensioners, decide against crucial treatment because they think the medication is too expensive. This is simply not true, and it is a huge misconception. Firstly, your health is priceless. The amount you would spend dealing with the aftermath of a major health crisis, like a stroke or a heart attack, or caring for a loved one who has become bedridden, is immeasurably more than the cost of simple blood pressure pills taken consistently over many years. Prevention, always, is far cheaper than dealing with a catastrophe. Secondly, the modern pharmaceutical market offers a massive range of generic medications. Now, don't misunderstand this. Generics are not fakes. They are high-quality alternatives to the original brand name drugs, manufactured once the patent protection expires. They contain the exact same active ingredient in the identical dosage, and they offer the same level of effectiveness, but they cost a fraction of the price. For nearly every expensive brand name drug, there is a far more affordable, yet equally effective, generic equivalent. You must discuss this with your doctor. Ask them to write your prescription using the generic or chemical name, the international non-proprietary name. With that name on your prescription, you can go to the chemist and choose the medication that best suits your budget. Furthermore, many life-saving medications, particularly those for heart and circulatory conditions, are often subject to price regulation or are included in schemes that make them much more affordable. In fact, for specific eligible categories of citizens, these drugs may even be provided completely free of charge. Therefore, money should never be the reason you skip essential treatment. Inaction will always cost you far, far more. Please do not cut corners when it comes to your well-being. Think of that daily tablet as an investment. It is perhaps the single most profitable investment you will ever make, yielding dividends in the form of many long years of active and happy living. We should also touch upon some of the other vital organs that suffer damage from hypertension. Take the eyes, for instance. The retina is crisscrossed by a delicate network of tiny blood vessels. Persistently high pressure damages these vessels, leading to bleeding and swelling of the optic nerve, a condition known as hypertensive retinopathy. In the early stages, this might go completely unnoticed, but over time it can cause progressive deterioration of your eyesight, potentially leading to complete blindness. That's why regular checkups with an ophthalmologist are so crucial for anyone with hypertension. By examining the back of your eye, they can actually see the condition of your blood vessels directly. Another major target is the peripheral arteries, particularly those in your legs. High blood pressure accelerates atherosclerosis, which narrows the space inside these vessels. This restricts blood flow to the leg muscles, causing a symptom we call intermittent claudication. When you walk, you get severe pain in your calf muscles that forces you to stop and rest. In severe cases, this lack of blood flow can tragically lead to gangrene and necessitate the amputation of the limb. So, as you can see, hypertension is a truly systemic disease. It doesn't just target one isolated organ, it systematically damages your entire circulatory system from head to toe. There is hardly a single organ or tissue that doesn't suffer from the effects of constant excessive pressure and insufficient blood supply. That's why, when you manage your blood pressure, you aren't just protecting your heart and brain against strokes and heart attacks. You are safeguarding your eyesight, your kidneys, and your mobility. You are protecting your entire body as a whole. This comprehensive defense ensures your general well-being and a high quality of life for many years to come. A lot of people worry that once you start taking medication, you're stuck with it for life. And yes, that is often the case. But really, why should that be such a frightening thought? Millions of people manage diabetes daily, taking insulin or other treatments. Those with hypothyroidism take essential hormones for their whole lives. They don't resent it because they understand that these are necessary treatments, a vital part of keeping them healthy. So why is there such a strange resistance when it comes to blood pressure tablets? Taking your blood pressure tablet should become just as natural and routine a part of your day as brushing your teeth. You wouldn't dream of skipping brushing, would you? You know it prevents decay. Well, this is the same idea, only the stakes are much higher. You take that tablet to prevent a stroke. This isn't a sign of weakness, it's a sign of wisdom and responsibility. Modern medicine has given us a truly unique gift, the ability to manage our health actively and prevent these dreadful illnesses from taking hold. To throw that opportunity away simply because of old fears or prejudice is frankly just not sensible. Look at it another way. Having to take medication for life isn't a life sentence. It is your personal ticket to a long, active, and fulfilling life. It's a very small price to pay for the chance to see your grandchildren and great-grandchildren grow up, to go travelling, enjoy your favourite hobbies, and simply be grateful for every new day you wake up. Surely 1 or 2 tablets a day isn't too high a cost for all that happiness. Try to change how you view your treatment. Don't see it as a burden, but rather as your trusted ally in the fight for good health and longevity. If you can do that, you'll find life becomes so much simpler and calmer, knowing that your greatest health threat is securely under control. Let's have a little talk about the impact of stress. Stress is arguably one of the biggest culprits when it comes to pushing our blood pressure up. When we get stressed, our bodies instantly release hormones like adrenaline and noradrenaline. These chemicals make our hearts beat faster and cause our blood vessels to tighten up. This is that ancient fight or flight response. It was crucial for our ancestors' survival, wasn't it? But today, our stresses are usually chronic and emotional. We're not running from a saber-toothed tiger anymore. Instead, we worry about the news, we argue with loved ones, or we fret about what the future holds. But the body's reaction hasn't changed a bit. All these constant emotional pressures keep our cardiovascular system in a state of chronic tension, which really helps hypertension or high blood pressure to develop and get worse. This is particularly relevant for us seniors, as we often struggle with loneliness, anxiety about our health, or worries about money. That's why managing stress is absolutely essential for keeping your blood pressure under control. So, what exactly should we be doing? Firstly, we need to sort out our sleep. A good, solid night's rest is truly the best medicine for stress. Secondly, consider relaxation techniques, things like breathing exercises, gentle meditation, or self-hypnosis. Even just taking 10 or 15 minutes a day for simple, deep, slow breathing can significantly lower your anxiety and your blood pressure. Thirdly, make time for pleasant activities that genuinely bring you joy and distract you from negative thoughts. Enjoy your hobbies, spend time with cheerful company, listen to your favourite music, or take peaceful walks outdoors. It's important to learn how to switch your focus away from worrying thoughts and onto something positive. Of course, we can't eliminate stress completely from our lives, but learning how to react to it properly, preventing it from taking a toll on your health, is an achievable and incredibly important goal for all of us, especially if you're living with hypertension. Right then, let's just recap the dangerous misconceptions we've tackled today, especially those surrounding the myth of the age-appropriate blood pressure norm. Myth number 1. A reading of 140/90 is perfectly normal when you get older. The truth. That is stage 1 hypertension, and it absolutely requires treatment. Myth number 2. Your blood pressure naturally goes up as you age. The truth. In a healthy body, your blood pressure remains stable throughout your life. Any persistent rise is a definite sign of an underlying vascular issue. Myth number 3. If I feel fine, the numbers don't matter. The truth. High blood pressure is often called the silent killer because it can be entirely symptom-free for years, silently damaging your body from the inside. We must rely solely on the readings from your blood pressure machine. Myth number 4. I have my own personal working pressure. If it drops lower, I feel ill. The truth. That feeling is a symptom of your brain having pathologically adapted to abnormally high pressure. Your body needs to be gradually retaught how to function properly at normal, healthy readings. Myth number 5. It's dangerous to lower blood pressure too much in older people. The truth. With a proper, gradual approach, bringing your pressure down to the target level, that's below 130/80, is perfectly safe and absolutely vital. The risk of doing nothing far outweighs the risk of treatment. Myth number 6. Blood pressure pills are just bad chemicals. I'd rather stick to herbal remedies. The truth. The effectiveness and safety of modern hypertensive drugs have been proven in thousands of clinical trials. No folk remedy or herbal tea can guarantee reliable control over your blood pressure or protect those vital organs like your kidneys and heart. Myth number 7. You can just take a course of tablets and be cured. The truth. Unfortunately, hypertension is a chronic condition. It requires consistent, lifelong medication. Please make a note of these points. Share them with your family and friends. Knowledge truly is your main weapon against this sneaky disease. Don't let outdated, dangerous myths control your health and dictate your life. A question we hear often is this: if you've already had a stroke or a heart attack, is it really worth treating high blood pressure? Many people feel it might be too late. The answer is a resounding and firm no, it is not too late. In fact, treating high blood pressure is absolutely essential. Secondary prevention, that means stopping a second disaster from happening, is one of the most crucial parts of modern cardiac care. If you have already developed fatty deposits or plaque buildup in your arteries, whether it's the heart or the brain, you are automatically in the very highest risk category. For you, tight control of blood pressure becomes even more critical than it is for someone without those previous problems. The right treatment plan after a heart attack or stroke helps to stabilise those existing plaques, preventing them from rupturing, stopping blood clots from forming, improving blood flow to the affected areas, and reducing your risk of a repeat incident by dozens of percentage points. Your target blood pressure levels might even need to be stricter than normal. Additionally, your treatment regimen will certainly include other types of essential medications, such as statins to lower cholesterol and antiplatelets, often called blood thinners, to keep your blood flowing smoothly. This is comprehensive work aimed at halting the progression of the disease and preventing another tragedy. So, if you or a loved one has suffered a cardiovascular event, this is absolutely not the time to give up hope. On the contrary, it should be the strongest possible motivation to take charge of your health with absolute seriousness. Your quality of life after a heart attack or stroke depends directly on how meticulously you monitor your blood pressure and follow every recommendation from your doctor. This is your second chance, and it is too valuable to miss. Let's look at another very common mistake: treating yourself. We often hear advice from neighbours or see convincing adverts on the telly, and before you know it, people are taking random pills to try and bring their blood pressure down. We hear things like, "Well, this pill worked wonders for my neighbour, so I'll give it a go." This is an incredibly dangerous path to take. Firstly, there is no such thing as a magic, one-size-fits-all blood pressure pill. Finding the right treatment, the therapy, is always a strictly individual process. Your GP has to take many things into account: your age, any underlying conditions you might have, such as diabetes, kidney problems, or coronary heart disease, your cholesterol levels, and the results of your recent checkups. A medication that works perfectly for one person could be completely ineffective or even harmful to someone else. Secondly, the correct dosage is absolutely crucial. Only your doctor can figure out exactly what dose you need and how to carefully adjust it as your treatment progresses. Thirdly, different drugs work in different ways, and often, to truly get your blood pressure under control, you need a combination of 2 or even 3 types of medication. Only a medical professional has the knowledge to put together such a tailored plan. At best, attempts at self-medication will simply be ineffective, meaning you waste valuable time while the illness continues to progress. At worst, you could cause irreparable damage to your health. For instance, certain medications are strictly contraindicated if you have existing kidney or heart problems, and taking them could lead to severe complications. So please remember this: The only source of prescription medication for treating hypertension must be your own consulting GP. Don't take matters into your own hands and never trust the advice of unqualified people. Your health is far too valuable to be conducting risky experiments on yourself. Now, a vital point we absolutely must cover is the combination of high blood pressure, hypertension, and diabetes. This is a deadly combination, exponentially raising the risk of all cardiovascular complications. Both diabetes and high blood pressure target the same area, your blood vessels. Diabetes damages the internal lining, known as the endothelium, making it critically vulnerable to cholesterol. Hypertension then aggravates this process, speeding up the growth of those dangerous plaques. Together, they act like two accomplices, working with double the force to destroy your system. This is why, for diabetic patients, blood pressure control is of paramount importance. Their target levels are significantly stricter. If 135/85 might be considered conditionally acceptable for an otherwise healthy elderly person, for a diabetic, those numbers are already far too high. Their goal is 130/80 or below, and ideally even lower than that, provided it is well tolerated. Furthermore, when treating hypertension in diabetic patients, we prefer specific groups of medications, ACE inhibitors and sartans. These drugs not only lower pressure but also offer crucial additional protection for the kidneys, which are often the first organs to suffer damage from diabetes. If you or your loved ones have both high blood pressure and diabetes, you must understand that you are in an extremely high-risk category. For you, monitoring your pressure, blood sugar and cholesterol is literally a matter of life and death. There can be absolutely no compromises and certainly no excuses about age-appropriate norms. Only rigid, constant control and the meticulous adherence to your doctor's recommendations can save you from catastrophic consequences. As we wrap up this important discussion, I want to reiterate a crucial point. Getting older is simply not a disease. Of course, certain changes happen in the body as the years pass. Tissues naturally lose some elasticity and metabolic processes slow down a bit. But this absolutely doesn't mean we should just accept illness or treat it as normal. High blood pressure or hypertension isn't an inevitable part of old age. It's a treatable medical condition, regardless of how old you are. Modern medicine provides us with all the tools we need to live a long, active, and healthy life, keeping our minds sharp and our bodies resilient right into our later years. The key to achieving this is prevention and the timely management of chronic conditions, especially hypertension. By rejecting that dangerous myth of age-appropriate illness, you take the most crucial step on this journey. You are taking control of your own health. You are giving yourself the chance for decades of quality life, free from the severe consequences of inaction. Don't let this chance pass you by. Your life and your future depend on the decisions you make today, and let one of those decisions be this firm realization. A blood pressure reading of 140/90 is not normal. It's a warning sign that must not be ignored. It is a call to action, and if you heed that call, you will succeed. Let us once again discuss the practical steps you can take. Here is a simple, straightforward action plan designed specifically for people over 65. Step 1. Purchase an automatic blood pressure monitor with an upper arm cuff. Crucially, avoid wrist monitors. They are often less accurate, particularly for older adults. Step 2. Start keeping a detailed blood pressure diary. Measure your pressure twice daily, once in the morning and once in the evening. Always do this in a calm setting, following all the proper guidelines, and record the results meticulously. Aim to do this for at least 2 consecutive weeks. Step 3. Analyze those results. If your average readings consistently exceed 135/85 millimeters of mercury, it is time to book an appointment with your GP. If your numbers are higher than 140/90, this warrants immediate medical attention. Step 4. Find a competent healthcare professional. Ask friends for recommendations or check reviews online. When you go for your consultation, take your completed blood pressure diary with you. Step 5. Strictly follow all your doctor's instructions. Complete any tests required and start taking the prescribed medication exactly as directed. Never try to treat yourself and ignore the advice of well-meaning amateurs. Step 6. Make essential lifestyle changes. Reduce your salt intake, increase your physical activity, manage your weight, and stop any harmful habits. Step 7. Continue to monitor your pressure regularly and visit your doctor for necessary adjustments to your treatment plan. Your ultimate goal is to maintain a stable blood pressure reading of 130/80. This simple plan is your personal roadmap to healthy longevity. Follow it carefully and you will effectively avoid most of the risks associated with high blood pressure. Let's finish up by imagining that your blood vessels are the roads in a bustling, busy city. When your blood pressure is normal, that ideal 120/80, think of those as wide, open avenues with freshly laid, perfect tarmac. The vehicles, your oxygen-rich red blood cells, move quickly, traffic-free, delivering everything vital to every single district, every organ, right on time. The city thrives. Now 140/90 pressure is no longer a smooth highway. It becomes narrow side streets full of potholes, bumps, and constant gridlock. The vehicles crawl along, struggling to reach their destination. Certain parts of the city start to suffer from shortages. That's when real trouble begins. And a hypertensive crisis? That's a major pile-up, completely paralysing the main thoroughfare. The whole city is in absolute gridlock. Would you ever choose to live in a city with such poor infrastructure? Of course not. Likewise, your body absolutely doesn't want to exist when its vessels are sick and damaged. Looking after your blood pressure is essentially the same as managing the road network within your own body. It's preventative maintenance and major refurbishment that stops those catastrophic accidents and ensures every single vital system runs smoothly without interruption. Don't let your internal highways degrade into impassable back roads. Keep them in tip-top condition and your body city will serve you faithfully for many, many years to come. Hopefully, this image helps you truly grasp and remember that tackling 140/90 is not just a doctor's preference, but an absolute, crucial necessity for your continued health and well-being. Right, let's wrap up what we've learned today. We have successfully demolished one of the most dangerous and deep-seated myths in modern medicine. You now know definitively that a blood pressure reading of 140/90, whether you're 70, 80, or even 90 years old, is not normal for your age. It is a serious illness known as hypertension or high blood pressure. It is a silent but ruthless killer, relentlessly damaging your blood vessels, wearing out your heart, starving your brain of vital nutrients, and poisoning your kidneys year after year. We have established that modern scientific data and current clinical guidelines are absolutely clear. For the majority of older adults, the safe and effective target blood pressure is below 130/80, and achieving this target is an absolutely realistic goal, provided you approach treatment and lifestyle changes with the proper diligence. Please don't allow outdated misconceptions and a false sense of comfort to steal years of active, fulfilling life from you. Your health is ultimately in your hands. Do not ignore the signals your body is giving you. Measure your blood pressure regularly, keep a detailed log, and become an active partner to your doctor in the fight for a long and healthy life. Thank you so much for watching this vital video all the way to the end. If you found it helpful, please do give us a like and subscribe to our channel so you don't miss other medical myth-busting content. And crucially, please share this video with your parents, grandparents, and elderly relatives. You might just save a life. Now, a question for you. Have you or your loved ones ever encountered this myth of age-related normal blood pressure? What advice did your doctor give you? Please share your story in the comments below. Let's discuss this together. Your experience could be invaluable to others.